the workshop, you explored a range of issues associated with being a clinical facilitator for the University of Wollongong. Now it is time to consider how teaching in the clinical setting can be informed by educational theory and research. Your choice of strategies to assist your learners will depend on the learning outcomes you want your learners to achieve and any organisational or environmental issues in your particular clinical teaching context. Your ability to argue for the match between your choice of learning strategies and the learning outcomes within the constraints of the relevant contextual issues contributes to your being an informed educator. You will find that there may be an overlap between several of the educational concepts and processes that are addressed in the theoretical and research literature to do with education in the health professions. Educational concepts often feed into each other. They are not as discrete as many of the biomedical concepts with which we are already familiar. Experiential learning usually involves some form of learning experience. But an experience alone does not necessarily result in learning without some form of reflection. Reflection may enhance learners' cognition through the ways in which they make sense of their experience and develop some understanding of the concepts and processes involved. Cognition is the process of thinking, through which we develop our understanding. Effective cognition requires effective use of cognitive learning strategies for constructing our knowledge. Social cognitive theory suggests that learners have some self-regulatory capability. That is, that depending on their internal characteristics, learners make choices about their learning strategies to develop their understanding. Self-regulated learning is concerned with the methods that learners use to manage their learning, including, firstly, the methods they use and how they use those methods to think about and develop their understanding. Secondly, the methods they use to identify and control their motivations during the learning experience, as well as the strategies that learners use to manage those motivations that affect their learning. And thirdly, the methods that learners use to manage the self-evaluative aspects of learning. Self-regulation includes the personal aspects of motivation and behavioural aspects of goal setting. Learners' motivation may influence their participation in any learning process. For example, high motivation often results in more time and effort being put into learning processes. On the other hand, learners with low motivation often adopt a superficial approach and spend less time on learning. Goal setting is a key element of self-directed learning and learning contracts. Setting learning goals helps learners to direct their actions and provides a way for learners to test to what extent and in what ways they have met those learning goals. Adult learning assumes that learners see themselves, and need to be seen and treated by others, as being responsible for and self-directing in their decisions and actions. They draw on their intrinsic motivation to achieve their relevant, task-centered, job-focused learning. Self-directed learning is a process that adult learners use to set their learning goals, identify strategies to help them learn, and monitor their learning achievement. Self-directed learning relies on learners' internal motivation and their ability to use learning strategies effectively. These are just a small number of the many educational concepts that you may encounter in your role as a clinical educator or facilitator of learning in the clinical setting. The interrelationships between educational terms and concepts are very different from our familiarity with biomedical concepts, where, for example, the femur is always the femur and never anything else. Nevertheless, Your exploring of these learning resources should assist you to develop a better understanding of the concepts that underpin teaching and learning processes and strategies that you may choose to enhance learning in your clinical teaching context. This video was produced by Dr. Victoria Neville in the School of Nursing, Midwifery and Indigenous Health at the University of Wollongong in 2013.